Hi, what is your name?
My name is Christine Blank.
All right, Christine, go ahead and tell me your story about how you found us.
Well, let's see. Last May, so it would have been May of 2009, my jaw became stuck shut and I could only open it maybe enough to fit a toothbrush in.
How much?
Maybe about that much.
Okay.
So just barely enough to get a toothbrush in. And after calling around, I spoke with one dentist named Dr. Douglas Fain, and I went to see him.
He's a surgeon, right?
Yes, he is a surgeon, and he injected the disc
Into the jaw joint itself?
Into my jaw joint itself.
Both sides or one side?
Both sides. He flushed it with saline to plump it to actually force the lower jaw out of the position it was in. And he told me that probably wouldn't last very long, which it didn't. It was incredibly painful, and it only worked for about a week before my jaw became stuck again. He suggested Dr. Rahman, and I had done some research and finally found somebody who seemed to think they knew what they were doing in regards to TMD or TMJ disorder. So I came to see Dr. Rahman in October of 2009, and by this point my jaw had been stuck shut for about 6 months. So I had lost about 10 pounds and I was having headaches, severe headaches, about 4 to 5 times a week.
Okay. So when we met you, what did we do first?
The first thing you did was consult with me and just go through. You spoke about what you thought you could do to help me, but we needed to do a more thorough examination, hook me up to the jaw computer, take a CT scan, but you gave me hope. I left here in tears because you were the first person who actually took my condition seriously and didn't have some arcane suggestion like doping me up on Valium, taking NSAIDs all day, every day for the rest of my life, or putting basically a block of wood in there and cranking my jaw open.
So those are some of the other suggestions you had?
Yes.
Okay. And then, what did we do?
And then we went through this CT scan and you did the really lengthy first consultation, and I came back in with my mother and my boyfriend, and you went over everything with me, and we decided that you could help, so we started on that process. And the first thing you did was put the orthotic in the lower jaw, so in my bottom, just on my bottom teeth.
So it'll be neuromuscular orthotic to
Yes.
correct the jaw alignment.
Yes.
Okay.
And I quit having headaches as
And
soon
that
as
was
that went in.
That was not a permanent fix, correct?
Correct.
It was a reversible one just to see if we can help you.
Yes.
It's one thing for me to think I can, another one for you to feel better.
Yes.
Okay. And how much better did you get?
I felt 50% better right away because I quit having headaches. For the first time in my life, I went on vacation and I flew on an airplane and my ears didn't pop. I didn't have extreme pressure in my ears when we were ascending and descending. So that was actually, I was shocked.
I didn't know that.
I didn't realize that you putting an orthotic in would have that much of an impact on everything.
I see.
And so I quit having the headaches, and then over time, once my braces went on in January of 2010, I was able to get my jaw open more and more and more because it wasn't slipping and sliding around all the time, so it was stable, so the muscles could actually kind of work on stretching themselves out the way they were supposed to be instead of the way that they were. I also began physical therapy, I believe, in November of 2009.
This is after you're already feeling somewhat better.
Yes, after I'm already feeling somewhat better. And I began physical therapy to help and learn that
The posture, rest of your posture.
that my posture all the way down to my pelvis was affected by my hips, or by my jaw, by the problems that I've been having with my jaw and my neck.
All right. Then go on, please. Then what you do?
Then we had the braces on and I continued the physical therapy and I've continued feeling better. I actually have a job where I do data entry, so I sit in one position all day, which is not helpful to TMD patients, but my physical therapist also taught me how to sit properly, how to strengthen the muscles that needed to be strengthened to help hold that position so I could go to work more comfortably. And between the orthotic and the braces and the physical therapy, I have been in so much less pain than I was a year ago.
What percentage was it in?
What happened, I would go to work and I'd be at work for 2 hours last summer, and I would be miserable. It felt like somebody was holding a hot iron to my back. And then with the orthotic and then the braces and the physical therapy, it started to get better. And so
Can
now,
you work full schedule these days then?
yes.
Okay. You can work normal hours now?
Yes.
Okay.
I can work normal hours now. I still need breaks just because that is very helpful because it's just uncomfortable for anyone to have to hold that. So.
But it doesn't disable you anymore?
No.
Okay.
It hasn't inhibited me. I actually was able, after I got the braces off, to eat ribs and a hamburger for the first time in a really, really long time. No gum, but, you know, actually take a bite out of a sandwich and not have to cut it up into small pieces because it wouldn't fit in my mouth.
I see. Those are some of the quality of life issues, I guess.
Yes, and being able to yawn without it hurting, being able to smile for long periods of time without facial muscles fatiguing, those are all things that I was experiencing before I came to see you.
I see. So then what do we do then afterwards?
After you cut the braces off, you put the
Okay.
expander in the roof of my mouth, which was a delightful experience, but it was worth it. The expander went in and it widened the upper jaw. And then,
So we did all the orthodontic part to correct the jaw,
yes, to
shape
correct
and
the jaw
alignment.
shape and the alignment to allow my tongue room to fit comfortably in the roof of my mouth. When the orthotic stayed in, when the expander came out, it was one of the most bizarre experiences because my tongue can actually fit in my mouth, which sounds really strange, but when you...
So we looked at a lot more than the joint alone.
Yes,
Okay.
it affected everything.
So what is the last part of it that we just got done?
The last part of it that we just got done are my lovely teeth.
Okay. And you have porcelain restorations on all your teeth.
All porcelain restorations on all my teeth.
One thing I wanted to clarify, was it the only option we gave you?
No.
You had
The
many
other
options.
option that you gave me was braces, and I decided not to have braces for a lengthy period of time. I'm 31 years old. I was 30 when I started this process, and I have had problems with TMD since I was about 8 years old.
Okay. And you also wanted to improve the smile as well.
Yes.
Okay. Yeah,
Yeah.
pretty sound now. Okay. Would you mind reading the statement that is there?
No.
And then go ahead and you can pick it up and then read what's at the top. And
AADR TMD policy statement.
okay. And
Studies
then,
of the natural history of many TMDs suggest that they tend to improve or resolve over time.
okay. And what would your reaction to that statement?
That's a bunch of crap, because I have been having...
Say it again.
That's a bunch of crap, or baloney.
Okay.
I have been having problems with my jaw locking shut for as long as I can remember, so since I was about 8 years old, and before my jaw became stuck like it was in 2009, I had gradually, the 3 years previous, it had been getting, I'd wake up in the morning and it was stuck, so I could only get a toothbrush in and I could just eat yogurt. And at first it was just for an hour, and then it was for a couple hours, and then it worked its way into being 5 to 6 hours, and it would happen sporadically. You know, if I was under more stress it might happen, but sometimes that didn't seem to affect it. It would just happen. And then it got to the point where it was stuck for 8 hours at a time, and then it became stuck.
So when you went to Dr. Fain, the surgeon, how long was it stuck when you got and saw him?
I think it was stuck for approximately 2 months.
So
And
you-
I called around, and I had to call and call and call and find someone who, and I had to do it because my family physician and my dentist were just, you're at a dead end, we don't really know what to do. We can give you Valium so that you won't stress out, so that you won't grind
Okay.
your teeth, so that your jaw won't get stuck. Well,
The
that
pelvic
wasn't
was
the
just a
problem.
stress then? Is that what they were thinking?
Pardon?
They were thinking it was just stress that was causing it?
Yeah.
I
That
see.
was what every physician I had run into had thought. I even saw a specialist at KU Med who said, we really can't do anything for you. You just need to take anti-anxiety medication
For how long would you take that?
every day.
No,
forever,
you would have to take the rest of your life?
for the rest of my life.
I see. Are you on any medication for that now?
Nope.
Good. Anything else you want to add?
Just that I am very happy with the care and respect I have received here from Dr. Rahman and his staff. They're fantastic. And I just cannot thank you guys enough and for how nice you've been to me and how you actually made me feel like I wasn't crazy. What I had been experiencing was legitimate, and that there was a legitimate way to fix it that wasn't something odd or that required medication or something archaic.
Thank you so much.
Thank you.